again to another press conference put on by the government of Anguilla. We'll start, as we always do, with a word of prayer. Dear Father, as we come to you today in this press conference to bring you the happenings of the country as we got it from government side, we thank you for bringing us through a safe weekend. We thank you for keeping us safe through this epidemic and this cluster that we had here in Anguilla. We ask for your continued blessing on all that we do. In your name we pray. Amen. Good afternoon again. I trust that everyone had an enjoyable Anguilla Day weekend, and happy Anguilla Day to those who I might not have been able to say happy Anguilla Day to in person. We are back here again with our weekly press conference, once again virtually. And we will start with the opening statement by our Premier, the Honorable Ellis Webster.
Good afternoon, Honorable Merrick. It's a pleasure to be here. Good afternoon to all those who are participating, whether as the media, the ministers, the parliamentary secretary, ministerial assistants, and Anguillians here and abroad. Certainly, it's a pleasure to be here on. It's a Tuesday today, and we celebrated yesterday Anguilla Day, the 54th anniversary of the Anguilla Revolution, and we had it, had to be inside and had it limited in scope because of COVID-19, and this is the second year where we could not have the event at the James Arnold Webster Park where it's usually held. However, we had a good presentation. I think the speeches were all, commemorative, respectful of our heroes and heroines and our patriots, and also, honorees. We wish them congratulations and thank them for their contributions to social development. There were Mrs. Mona Fleming, Anthony, Dr. Splinter, Brian, Mrs. Florence Harrigan, Mr. Elvet Hughes, and posthumously, Mr. Clive Carty. And certainly we know that there are many Anguillians who have contributed to where we are today, and we certainly want to pay our respects and look forward to our contributions as we set a pace for where Anguilla will be in this 21st century. I want to give the COVID-19 update. As of today, the 1st of June 2021, there are no active cases. The last positive case recorded was on the 10th of May. 2 incubation cycles of 14 days each will bring us to the 7th of June. If we continue to have no cases in that time, then we'd say we have overcome this cluster, and we thank God for that. As you recall, there were 78 positive cases that came out of that cluster. Certainly want to thank the people of Anguilla and the health team, the Royal Anguilla Police Force, and all who helped to contain and control the cluster that we had. Want to thank the medical staff at the Princess Alexandra Hospital for taking care of the 3 persons that ended up in the isolation ward, and they have fully recovered, and we thank God for that. I just want to state that the portal is up. We'll hear more about that later. Visitors and residents are now able to come to Anguilla, and I want to reiterate that everyone wanting to enter Anguilla must apply at least until the 1st of October. And so you must apply to enter Anguilla on the portal and need a negative RT-PCR test 3 to 5 days before arrival. Fully vaccinated persons will need to be quarantined for 7 days until the 1st of July, when we hope, if everything remains the same, that we'll not require quarantine for fully vaccinated persons. That is, persons who've had their 2 shots of the vaccine with at least 3 weeks past after the 2nd dose. Unvaccinated persons will need to be quarantined for 10 to 14 days. Persons will be tested also on arrival until we hope the 1st of July, when we will do random testing and testing of those who are unvaccinated. In terms of the vaccines, we have, as of today, 9,499 registered persons. Of those, 9,044 have had their first dose, and of those, 5,513 have had their second dose. So we're going in the right direction. We certainly have a target of 12,600. We are hoping to get to 10,000 because we have capability of 10,000. In fact, we have capability of doing 10,250 because we got 500 doses from Montserrat that came in before the end of May and were deployed. I want to encourage all eligible persons to get vaccinated. The number of positive cases in the world, and especially in the US, has decreased significantly. The number of hospitalizations has significantly decreased, and the number of COVID-19 related deaths has significantly decreased. And this is all correlated with the increase in the number of persons that are vaccinated. And so I think that it is incumbent upon us as good citizens who care about each other and care about ourselves, that we become immunized and that we protect our health, protect that of those around us. And this will help us to get to a state where we can feel more comfortable lifting restrictions and opening up the country so that we can have economic progress. And so again, I ask that everyone who's eligible, that is anybody 18 and older, who is not pregnant and who does not have a medical condition that would prevent them from taking the vaccine, to get the vaccine. First doses are still available. And so let's continue to encourage each other to protect ourselves. And I want to thank you for listening. I turn you back over to the moderator.
Thank you, Honorable Premier. We'll now have an update by the Commissioner of Police, Mr. Lynch. You can go ahead.
Good afternoon, everybody. An update: over the bank holiday weekend, we've done 23 land patrols, just monitoring, obviously, on land, looking at our borders to make sure there are no breaches. The vehicle checkpoints all ceased on the 28th of May, so we've done no vehicle checkpoints. And over the last 3 days or so, we've done 7 sea patrols. We've spotted 1 boat, which we weren't able to intercept. But that's the sort of the prevention side of it. I've been asked a few times now about the prosecution side and what we're going to do with a number of people who've breached it. The situation with the breaches is we have approximately 95 breaches so far, which we're going to put before the court. The reason I say approximately, we still have a number of other cases we're just looking at, and that number will probably go up by about 7 to 10, depending on which way those cases go. We anticipate somewhere ending up with about 100 breaches in relation to this. I don't know when all the people will go before the court. I know there are some cases on the 22nd of June, but we are going to take as many cases as we can through the court system, because I've heard the Premier repeatedly say we've dodged a bullet this time, and we dodged a bullet because somebody became symptomatic very early on in with this illness, and that allowed the health service here to do a fantastic job and contain everybody. But if that had not happened, then it would have been a much more difficult job. So we are going to take this very seriously. We are going to ask the court to present these cases before the court, because I think it's the right thing to do. The other message is, obviously now as the situation has become slightly more relaxed, I mentioned once before that the majority of the information we have about breaches is amongst the community. And we really do need people, because I do say we have dodged, echoing what the Premier says, we have dodged a bullet with this. We do need people, if they know people are likely to breach these regulations, to email us on that confidential email line, which is www.gov.ai/911. That's www.gov.ai/911, and tell us. And I can reassure the public, and I said it beforehand, even I don't get access to that information. It's dealt with off island, it's totally confidential, and it's sent back to us to action, and we then do follow it up. Because if people are breaching this and going to other islands and then coming back, then we do need to know, because you may not be so lucky next time, and we may not dodge that bullet next time. So please, if you've got that information, members of the public, please send it through to us and we will follow it. And I think you can see from the numbers we've got now, we are going to pursue the breaches. So please, if you've got any information, please put it on that email line. Please be reassured, even I cannot access that email. It's dealt with offline. The information is sent through to us, and then we will act on it and make sure we follow the breaches through, because it's imperative we don't get that infection back on this island. That's the update from the police side.
Thank you, Mr. Lynch. We now get a tourism update from the Parliamentary Secretary, the Honorable Quincy Gomes-Marie, who will also be speaking about the visitor portal and returning residents. Mrs. Gomes-Marie.
Good afternoon, Mr. Richardson. Thank you. I would like to take this opportunity to wish all Anguillians, both near and far, happy Anguilla Day. It's a day late, but happy Anguilla Day nonetheless. And I wish that we can continue the dream of building a strong and free country. So by way of update, since the launch of the portal on May 19th and the reopening of the borders on May 21st and 25th, we have received approximately 2,360 applications and have successfully processed about 710 persons or so. The portal was moved in-house and managed by a highly skilled team of civil servants whose efficiency and commitment to excellence is noted and appreciated. We saw heightened arrivals over the Memorial Day weekend, what we know to be Anguilla Day weekend in Anguilla, and we anticipate steady increases well into July. It is important to note here that the overwhelming majority of persons arriving were vaccinated. So that means that that's good news for our July portals, our July protocol, where visitors must be vaccinated prior to entry. Just a pause here. Locals and returning nationals will not require vaccination to re-enter, but if they're not vaccinated, they will have to undergo regular quarantine with the usual fees. But any person visiting after July 1 must be vaccinated prior to entry. They will then upload their negative PCR tests on the portal and come into the island without fees. And that's the same for returning nationals who are vaccinated. You just upload your negative PCR test 3 to 5 days prior to arrival and you enter without fees. I was alerted this morning about a Facebook post in circulation that highlighted a disparity between the visitors and locals for application time. This language was an unfortunate human error, which was brought over from our previous website because we recently relaunched the website. The website has recently been updated and will now read, quote, processing time, persons staying at private dwelling homes 10 days, which allows for home inspection and approved accommodation, such as hotel, resorts, villas, etc., 5 days. So previously would have said locals 10 days and visitors 5 days. That was from a time in our protocols where locals were the only persons allowed to stay in private dwelling. And the disparity between 5 days for locals and 10 days for locals and 5 days for visitors is because every person coming into our private dwelling must have their homes inspected by the environmental health unit. And so it would give you enough time to undergo that entire process. The team will come in and look at the homes and ensure that the layouts are one that can facilitate social distancing and the quarantine period. So it definitely wasn't something to disadvantage returning nationals and locals in any way. It's just that every person who would have stayed at home to quarantine would have had to undergo the same process of having the environmental health unit go into their homes and certify that their homes were safe for quarantine. And when you look at the visitors' experience at that time, visitors were only allowed to stay at approved locations. Now you can stay at a friend's home, whichever one you would like. But at that point, visitors were only allowed to stay at approved locations. So approved locations would be resorts, hotels, villas, etc. And the reason why the processing time was 5 days for visitors is that every hotel, restaurant, villa, resort would have been pre-approved by the environmental health unit and had their safe environment approval and seal of approval, which meant that they did not require additional certification each time someone would come and visit the property. I want to also take this opportunity to thank the environmental health unit for the amazing job that they have been doing. They are part of some of the unsung heroes of this pandemic. They have visited every home for every national or every homeowner in Angola who would like to quarantine at their homes. They have certified every restaurant in our bubble, all of the bubble-approved activities, and they would have certified all of the villas, all of the hotels, all of the resorts. So I would love to take this time to just highlight them and thank them for the job that they have been doing, because they have been doing so in an efficient manner. And every person who come into the environmental health team, nothing but good reviews. And we really want to take this opportunity to say thanks. And that's it on my end.
Thank you, Mrs. Gomes-Marie. Next up, we'll have an education update by the Honorable Deanne Kentish-Rogers. Ms. Kentish-Rogers, go ahead.
Thank you, Honorable Ministerial Assistant, and good afternoon to the people of Angola here and abroad. I must also join my colleagues in wishing everyone who I haven't had the opportunity to wish a happy Angola Day. I know that it was yesterday and officially on Sunday, but my hope is that everybody enjoyed their Angola Day and their holiday. As it relates to education, the Ministry and Department of Education would have put out its 12th statement in relation to the confirmed COVID-19 cluster and the reopening of schools. As you know, the schools on the island have returned to classroom environments on the 1st of June, which is today. As we have stated, we know that in this particular circumstance, there will be difficulties and challenges, especially as it relates to dealing with children's learning gaps and dealing with social isolation that has been experienced during this lockdown period. But it is our intention during this connection between students and teachers that we can ease this social isolation, reconnect our students, and address these learning gaps and the well-being of our students. In the update that was provided, you will see that all persons are mandated to wear masks at the schools. These are in accordance with the Government of Angola's regulations, which will be updated on the 7th of June 2021, when the second incubation period ends. At this point, the Ministry of Education will receive and disseminate an updated notice as it relates to mask wearing after consultation with the Ministry of Health. We know that there is difficulty as it relates to students wearing masks and being able to properly wear them. But we also know that students model the behavior of persons in authority, their parents and their guardians. So it is the request of the Ministry of Education, Department of Education, that all adults practice proper mask wearing techniques so that they can model them for students, so that they can follow their practice in school. As it relates to physical distancing in schools, we know that there is a challenge with physical distancing as a result of infrastructure loss caused by Hurricane Irma. Where it is possible, the schools all will enforce physical distancing. And where it is not possible to enforce physical distancing, especially at some very smaller schools, the Ministry of Education has advised us that since the island is at stage 0, which means that we have no active COVID-19 cases on island, the safety of our children can be adequately dealt with via the wearing of masks and frequent hand washing. We are also aware that a number of parents and students have decided to remain in remote learning or a distance learning setting. And this is being facilitated through the Department of Education. If there is an issue as relates to distance learning, you are asked to please contact the Department of Education in relation to your child to make an application for your child to remain in distance learning for the remainder of the school term. As it relates to preschools, the ministry is aware of complaints from parents at this preschool level in relation to the closure of one of the preschools for the remainder of the term. We must remind parents that preschools are private institutions and not directly under the remit of the Ministry of Education. While we acknowledge the vital importance of preschools, it remains the responsibility of parents to liaise with these institutions to work out arrangements that are suitable for their children. The ministry is inviting all parents of preschool students to make alternative arrangements, and we are aware that other preschools have spaces for preschool students at this particular time where they may not be able to attend the closed preschool at this point in time. We have been encouraging our teachers to vaccinate, as they are responsible for a large portion of the population who do not have the ability to vaccinate, which is children, with an emphasis on protecting vulnerable children, as many of them suffer from respiratory conditions such as asthma. We know that children come from households where there may be varying vaccination status as it relates to parents, guardians, and relatives. And while we acknowledge the risk that is there, the Ministry of Education has a direct responsibility to provide a safe learning environment for children and a safe system of work for teachers. And as we attempt to do so, we will continue to look at measures to mitigate that risk as far as possible for both teachers and for students. We know that a number of parents have asked about the vaccination status of teachers, and we want to reiterate that while we can disclose the general percentage of the workforce that may be vaccinated in line with the health team's releases, we are not allowed to disclose a specific person's vaccination status, as that's medical information. Any further information as it relates to the protocols for the reopening of schools, the guidelines, can be found on the Department of Education's Facebook page, where we set out the general guidelines for COVID-19. We set out a number of pages that you can contact if you want information as it relates to COVID-19 and the schools, our hand washing and our hygiene guidelines. They also provide guidelines for persons who are visiting the school, and they are required to wear a mask to the school. And we also have required our teachers to wear masks and our children to wear masks. So just to reiterate, all of these guidelines are on the Department of Education's page for your perusal. If there's a specific section that you feel has not been included, you can reach out to the Department of Education for further clarification.
Thank you, Honorable Deanne Kentish-Rogers, for your presentation. We now go to our press for questions. Felicia Hennis, Radio Anguilla, you may go ahead.
Good afternoon. Ms. Kentish-Rogers just spoke about the teachers being vaccinated, and she said while they cannot release personal information, I'm sure persons might be interested in knowing what is the percentage of teachers who are vaccinated, whether it's 40%, 20%. Would that be something you'd be willing to disclose?
At the moment, the last update I had, which I must admit isn't completely up to date as of today's date, there were over 170 persons who in education who are vaccinated. I'm not sure whether or not that was updated since then, and I'm sure it has, but I can't speak to the updated figure.
Okay, thank you. I have a question for the Parliamentary Secretary, Mrs. Quincy Gomes-Murray. And she mentioned the increase in tourist arrivals over the weekend for the Memorial holiday. How do you anticipate the rest of the tourism season?
Thank you for that question, Felicia. We are set to have one of the best Julys that we've had in many years this July, and we are very excited about what our festive, the period in November to January of next year would look like based on bookings. I think I had a call with some hotel owners would have said that the organic bookings have increased exponentially. We have done this by supporting the industry, by keeping Anguilla top of mind while other countries were for lockdown. We did a lot to encourage interest in Anguilla, and to use a term by the Minister for Tourism, there's a lot of pent-up demand, and we are seeing that reflected in the numbers.
Okay, thank you so much.
Don, I see your hand up. You can go ahead.
Thank you very much. Good afternoon, all. Minister Rogers, I have a question. You said about approximately 170. Again, I'm trying to get to a percentage. Do you happen to know what the denominator would be? 170 out of what?
I believe the last figure I had was 270, about 270, but I can, before speaking definitive on it, I would prefer to come back with an updated figure.
Okay, great, thank you. And could you, is it all right to disclose the name of the preschool that has not reopened? Is that a violation of confidentiality?
No, it's not a violation of confidentiality. Of the preschools, St. Mary's Preschool has decided to remain closed at the moment.
Okay, thank you. And I have one more question for Commissioner Lynch. Commissioner, you talk about breaches and you said approximately 95 to 100, but you also talked about, breaches leaving the island. And I can't imagine that all of those breaches are people who left the island. So could you specify how many of the total number would just be, driving when they should not have been driving versus the number who have been charged for actually leaving the island? Has anybody been charged for leaving and re-entering at this point?
No, we've got one investigation which we're doing, that's probably going to involve that sort of offence of people leaving the island and coming back. But nearly all the breaches have been people not complying with the regulations whilst they've been on the island. There's very few breaches of people coming into the island. There's probably only one or two, which we're just trying to complete the investigations on.
Okay, I was just trying to clarify that in my mind. Thank you.
Thank you.
That's it for me.
Premier, while we wait for questions from the press, I have a question. Someone is asking for the clarification of the number of days for quarantine, whether it's 10 days or 14 days.
The number of days for quarantine has always been dependent on the prevalence of disease and the country where persons are coming from. As the epidemiology has improved, we have considered decreasing the days to 10 days. Well, it's been 10 days for low risk countries and 14 for high risk. We have looked at bringing it down to 10 days for those who are unvaccinated. However, given the variants in places like India and Brazil and things like that, these are numbered. The days will still have to be determined, and that will be determined by where the person is coming from, and we will have regulations pertaining to that. Certainly, that's informed by the epidemiology and the science.
Thank you, Premier. Felicia, I see your hand up.
Yes, thank you. Dr. Webster, we know the pandemic has negatively impacted government's revenue. How would you describe the loss?
And that's an excellent question. I mean, the pandemic, since it was declared in March of 2020, caused significant erosion of government revenue. It was projected in 2020 that there would be about a $97 million EC loss of revenue. And we did get financial aid from the United Kingdom, and we thank the United Kingdom citizens for the generosity, up to 100 million EC dollars to decrease the negative impact of the pandemic. At this time, we still have the Ministry of Finance looking at what the impact has been on our finances from when this cluster started back on the 21st of May. 21st of April. And we're certainly getting the information on that, and we'll bring that to the public. But we do know that since our phased reopening in November of 2020, that there was some increased numbers in tourism, and the economy was starting to come back slowly, but it was coming back. Persons were getting out to work, and then everything ground to a halt again on the 21st of April when the cluster was identified. And the impact of that has been significant because we still were continuing to give unemployment and underemployment benefits. We still need to manage our debt, pay our bills, and certainly, that impact has been felt. And so that's why, I continue to say that, it is, acts that can lead to reintroducing the virus into the country that I think are very selfish. And I'm not apologetic for saying that. Certainly, we do know that by opening the country to visitors, that there was risk that that the virus would come in, but in a controlled manner. We were doing tests prior to arrival, tests on arrival, and there were 27 cases that were identified and were isolated and were controlled during that process. But it was this cluster that we know, based on the information we have, that was not due to the bubble. And that led to 78 cases, and 3 of those ended up in the hospital. And this had the risk of getting out in the community and causing, significant, problems. And so that's why we say, we want to be able to control this, but the only way we can control it is to follow the regulations that are informed by what we know is possible. You see what's happening in St. Martin, you see what's happening in St. Kitts, you see what's happening in other islands and countries in the region. Look at Trinidad, which is completely locked down. These are the risks that can happen with this virus, and which Anguilla cannot, survive from. Because if you imagine that we had, at the time when the 3 persons were hospitalized and they had significant symptoms, we only had 66 cases positive at that time. If you double that number of cases, double the number of people in the hospital, we would have used up the ventilators that we had if they got that sick. And so with 10 beds, we have to be very careful. That's why I continue to encourage persons to get vaccinated, because we've shown that vaccination does decrease the chance of getting significant disease, does decrease the chance of hospitalization, and does significantly reduce the chance of dying from this disease if, God forbid, it was contracted.
Thank you, Premier. We'll take a question from Brenda Carty.
Good afternoon. Now that the hotels are opening back up, I'm wondering what is the total percentage of hotel workers that have been vaccinated? Because a couple of weeks ago, it was only 50%. So I'd like to know what is the percentage now, and what will happen to people who are not vaccinated if they're facing tourists coming in? Will they be losing their job? What is the position?
I'll take that, moderator. The numbers have not significantly gone up above the 50%. They're still in that range for hospitality workers, based on persons identifying what they do, what their work is. We anticipate that we have missed some persons in the hospitality industry because they may not have stated what their employment is, but it's still in the 50% range. And in terms of whether persons will lose their job, we have said that we're encouraging persons who have unavoidable contact with the public or with visitors to get vaccinated. Certainly, businesses have the right to protect themselves, their businesses, their guests, and those decisions are being made by the hoteliers and the owners, restaurants, and other businesses. The other question that would come is the public service. We're also saying that persons who have unavoidable contact with the public need to be vaccinated. And, so we are encouraging people to do that. And, we have asked the Attorney General's office, the chambers, to work on regulations pertaining to that.
Thank you.
Don, I see your hand up. You can go ahead.
I'm sorry, it should have been down. Apologies.
Oh, okay. New Beginning Radio, you can ask your question.
Yes, good afternoon, everyone. And I believe my question will be for the Minister of Health, the Honorable Premier. Today, we know that China has reported a first case in the H10N3 virus, the bird flu. Does this concern our health officials here, seeing that Angola has some direct or indirect connections with China in travel and in trade as well? Is there any concern?
Thank you for the question. That's, certainly we have always been concerned about these new variants, the India variant, the Brazil variant, now, showing up in China. We do know that, once there's travel, that there is risk. And so the health team is, conscious of these. And certainly discussions are ongoing right now with the health team as to whether we will start restricting persons from specific countries. Again, that will be based on the epidemiology and the science. And we do know that the vaccine has been shown to be effective against most, if not all, of these variants. And so that's why we continue to encourage that.
Okay, thank you.
You're welcome.
Thank you, Premier. We'll take a question from the Anguillian.
Good afternoon, everybody. I just want to ask one solitary question. and it's to Commissioner Lynch. What about the investigation? How far are we with the investigation of those person who made the breach in the first place to cause the cluster and the close down? How far are we with that investigation?
Yeah, that's we've asked for some information from the Department of Health, which obviously they can't necessarily provide us, and they're not clear. So we've then put a request into the St. Martin government, and they're willing to help us. It goes back a little bit to my point earlier on about the information coming from members of the public, because we started the investigation, but it's a massive job to identify exactly where these people, whether or not any Anguillans have been on St. Martin, scouring hour after hour after hour of CCTV. It's a huge job, and it's a disproportionate job at this minute to try and do that. So we are hoping that members of the public on that confidential email, which is why I keep trying to reiterate it, www.gov.ai/911, will give us some information that will allow us to narrow down that search, and then we will definitely pursue that or those people that have breached those regulations. And I can't stress enough that that there's obviously some belief that people have been to St. Martin. If that's the case, we will definitely investigate it, but we do need the public's help, and we do need the public to come and tell us and give us an indication of who those people were and when they were there, and what time of day preferably, to try and save hundreds of hours of trying to spend time looking at CCTV, which is totally disproportionate to try and do at this point in time. So, and as we look forward as well, what we don't want to do is anybody taking risks on other people or gambling with other people's lives by breaching those regulations again. So if anybody does decide to leave this island and does decide to mingle with people in an illegal way, then we do need people to tell us so we can protect the people of the island, because if we don't protect the people of the island, we can't protect the economy, can't protect the jobs, etc. So I appreciate sometimes people are very reticent to give information here, but that email line is confidential, and it's absolutely imperative for people's economic future as well as their personal health, that they make sure they give us information to make sure we keep this island safe. So all I can do is ask people to give us that information. We will definitely respond to it. You can see we're very keen to prosecute people who breach these matters. And certainly if people got information about that people have previously been to St. Martin before this pandemic started, and they can give us the time, the date and the location, we will definitely investigate it, and we will try our very best to make sure people are brought before the court for breaching those regulations.
Thank you, sir.
Thank you, Commissioner. Felicia, your hand is up. You can go ahead.
Thank you. This is just a follow-up to my question to Dr. Webster. When I asked about the loss in revenue, he said it was significant, Dr. Webster. I know you've been strong against the sale of AGLIC and the reduction in pay for civil servants, but given these new realities and the position that government is now in, do you think you may have to rethink your decision?
Not regarding AGLIC. I still think that AGLIC is a vital asset to the people of Anguilla and needs to be retained locally. I feel that if AGLIC was a fully private entity right now owned by foreign interests, that we would have been in much worse stead, because we could not have appealed to AGLIC to give the no-cut orders to hold off on sending out the electricity bills and the early stages of the pandemic. I think that persons would have been in a worse state. We could not have asked them to not raise the fuel surcharge like they have done so far to hold back on that, which they can do by their policies and by legislation. But we have asked them to, as a good corporate citizen. They have held a line with us, and those are the things that we have to be cognizant of. We have to look out for the interest of the people of Anguilla while this is going on. And certainly it might be easy, to get rid of AGLIC in a fire sale, but the thing about it with that, with AGLIC, all the sale of AGLIC would have done is raise $24 million to pay debt. And, certainly I don't think that the impact would have been felt positively. And so that's why I think we still have to retain AGLIC. Now, in terms of other options, we certainly know, given the huge national debt that we have, it restricts what we can do. It affects our ability to borrow to cover the social programs and policies that we want to implement. It certainly does affect our ability to provide certain services. And so we go along with that. We know that we have to make sacrifices. Yesterday or the day before, it was Anguilla Day, commemorating the revolution. When all Anguillians banded together for one common purpose, united, and knowing that they had to make sacrifices, but also had to, put themselves in danger and at risk to get this country going and to get it to where we are. And so the intentionality and the commitment, as the theme was of yesterday's, Anguilla Day celebration, we have to have that type of commitment and that type of be resolute so that we can, help this country to move forward.
And the reduction in civil service space, is civil servant space this imminent?
Again, I have said from the time that from June 30th and prior to that we do not feel that reducing civil servants' pay would be good in this type of economy. The civil servants are they're the ones contributing Social Security. They're the ones, contributing to paying loans at the bank. And those are the ones who have extended families now that they may not have been taken care of prior to this pandemic, that now they are required, to support maybe their parents, their neighbors, and others. And so I think that the scarring that would occur if there's a reduction in the public service salaries would be something that it would be difficult to recover from. And this administration is not inclined to do that. Certainly, it is there as an option if we get to the point where it's absolutely necessary, but it would take, a lot for us to enact that. As I said, the legislation was passed by the previous administration, but we have chosen not to go there.
All right, thank you so much.
You're welcome.
Thank you. New Beginning Radio, you can ask your question.
Yes, we had a question coming in, and I believe this would concern our education department, our Minister of Education in particular. While the government is requiring that teachers vaccinate, and from reports a limited number of them have indeed been vaccinated, is the government concerned about private schools, home schools and preschools?
Is the government concerned about private schools, homeschools, and preschools?
Yes, I guess that implies where teachers might not be vaccinated.
Well, the government of Anguilla still has the ability to create regulations for all manners of schools operating on the island. Although the difference is that the private schools have their own governing bodies and structures. But in a public health crisis, there would be certain conditions that would be extended to the schools by virtue of it being a nationwide issue. As we've said before, we continue to encourage persons to vaccinate where they can, and we'll continue to look into circumstances that can mitigate the risk of contracting COVID-19 on the island and in the education system.
Thank you.
Okay, thank you. While we wait on some more questions from the press, Premier, I have a question for you. Will visitors be required to be vaccinated indefinitely, or is there an end date?
Well, I mean, that's an excellent question. Right now, we have not set an end date. And again, that will be dependent on the science and epidemiology. As we in Anguilla get more persons vaccinated, so we have herd immunity. As the world itself gets more vaccinated and the effects of this virus are decreased, and then certainly we will get back to what was normal, where persons came and went and it didn't matter. But as to when that will be, no one knows. But we certainly can help ourselves here by getting to herd immunity. That would help to protect us. Because there will be persons who will come to Anguilla who are not vaccinated. These are persons, Anguillians returning, and also there will be visitors who cannot be vaccinated. Children who cannot be vaccinated will be coming with their vaccinated parents. You may have persons who can't be vaccinated because of medical reasons who will come with their vaccinated loved ones. And so we have to mitigate for these circumstances. But again, at some point, we will get to where we won't worry about the vaccinated status of persons once the virus is under control.
Thank you, Premier. Felicia from Radio Anguilla, go ahead with your question.
Thank you. Dr. Webster, we're just coming out of the COVID-19 cluster and now we're in the hurricane season. Is there anything you can share with us on anything in terms of the government's plan in case of disaster?
Felicia, we are, today is the official start of the hurricane season, and we have been concerned about that. Disaster management usually comes under the auspices of the governor's office. However, it affects us all. We are looking to continue paying on the CRIF fund, which is the catastrophic risk insurance, to make sure if we do, God forbid, get hit by a hurricane, that we can, have recovery. We are making sure that they're in place, the different agencies, and there's equipment to help with rapid cleanup programs. We do have different groups in place. The NEOC, National Emergency Operations Center, that's there, and it's a very efficient group. And I think disaster management is well run and well directed. We certainly stay in touch with SEDEMA, which is the Caribbean Disaster Emergency Management Agency, and that's how we want to stay prepared, to make sure that if a hurricane is coming in our direction, that we get everybody informed, we get them prepared, and we have the opportunity for rapid response across the island to get us cleaned up, recovered, and any rescue that needs to be done would be dealt with. So yes, these are different programs that are in place that some were there before we came, some are being worked on now, but I'd say that disaster management, Red Cross, all the agencies, governmental and non-governmental, are already prepped for the possibility.
Okay, thank you.
Okay, thank you. We have another online question. Will persons have to complete the repatriation online forms after July 1st if they are fully vaccinated?
Yes. The COVID exit plan right now shows that up until the 1st of October, persons have to continue to apply, just like now, whether vaccinated or not. They will apply to come in. They have to have a negative PCR test done 3 to 5 days before arrival to Anguilla. vaccinated persons will not necessarily be tested, although we will do random testing, whether that's on, the children who can't be vaccinated or persons who, for medical reasons, can't be vaccinated, and even some vaccinated persons, because we still want to track to see, make sure that the persons coming in, that what type of variants may be, coming in if they do. And so these are, this is how we will manage going forward. We want to have safe entry into Anguilla, and we want to make sure that people also, when they come, visitors, that they can enjoy themselves, benefit from, good food and beautiful sandy beaches or turquoise waters, doing the activities that persons come to Anguilla to do. We have, high value tourism, and we want to make sure that persons, when they come, that they benefit from that. But we also want to keep Anguilla safe. So we will do what is necessary to ensure that we can protect the health of the people of Anguilla. That has always been and will always be paramount, which means that's our first priority.
Thank you, Premier. I'm not seeing any more questions. So I think we can start to wrap this up. Commissioner Lynch, you care to give us your closing remarks, please?
Yeah, thank you. I think my closing remarks really are, I've said it several times over the last few weeks, just thank you to everybody who's been so compliant and really worked together to unite the Anguillan people against this vaccine. Just to reassure people that we will take action against the ones who decide to breach it. Most are fairly minor breaches, and they're just sort of poor decision making, it seems to be. And the third one is just to remind people they must make sure that if they have information about people possibly going to try and enter the island illegally or leave the island to communicate with somebody in an illegal way, to please pass us that information to that confidential email, which is www.gov.ai/911. It is absolutely confidential. I say again, even I can't access it. It comes through to us, and we then take that piece of information forward, and we'll make sure we do our bit to protect the people of Anguilla. And that's it from me. Thank you very much for the invite.
Thank you, Commissioner Lynch. Parliamentary Secretary Quincy Gomes Marie, can we get your closing remarks, please?
Thank you, Marek. My closing remarks would just be about the portal in particular, to ask persons to ensure that they give themselves enough time to apply. It requires a specific test for arrival, and that is the RT-PCR test. And if you are leaving on medical purposes, it must be for medical services that cannot be rendered on island for you to qualify for medical exemption fees on your return. And in order to have that done, you just have to reach out to the CMO there at the Ministry of Health located in the Caribbean Commercial Complex with your referral. Once it's confirmed that your procedure cannot be completed on island, you can leave the island and return without having any fees. So just to let persons know about that. But information about the portal is available on the website, and any direction you need can be sought through there. Thanks.
Thank you, Honorable Parliamentary Secretary. We now go to the Minister of Social Development and Education for her closing remarks. Minister Kentish Rogers. Okay, Premier, I don't seem to have her on the line. So can we close off with you, Honorable Premier?
Yes, definitely. Moderator, I appreciate how smooth you went through today. It seems and the questions just show that persons are very much engaged and have stayed focused on this. And I think it's that which has brought us through this cluster. And I want to thank the people of Anguilla for, following the protocols, for being compliant. Certainly there have been some breaches, on the water, on the land, and this should not happen. Persons should be responsible. And, because it only takes one breach to shut this country down. And we certainly know what, how devastating that can be to our healthcare system, to our own people, our loved ones, our neighbors, and also to the economy. I just want to remind persons that most of the restrictions were lifted on the 28th of May, except for physical and social distancing, which means that persons have to stay at least 3 feet apart. Mask wearing is still mandatory when outside, and outside of your home and not around persons that you live with. And there's no night fishing allowed from boats. You can do night fishing from the coastline or diving, but no boats are allowed to be out at night. No boats on the south side of Anguilla without permission from the Royal Anguilla Police Force, and that is going to be strictly enforced. There should be no boats on the south side of Anguilla without permission from the police force. Visitors and residents must apply to enter Anguilla just like before, and have to have a negative RT-PCR test 3 to 5 days before coming to Anguilla. As the Honorable Parliamentary Secretary said, we anticipate increasing number of visitors in the next few weeks to months. This means that there will be, after July 1st, there will be persons coming into the island vaccinated who will not have to quarantine. Physical and social distancing still applies, which means even though we like to hug our visitors and shake hands, as we've been doing for the last year and some, we must continue to protect ourselves and our loved ones, and we need to continue that. The mask wearing continue as we get through this cluster. Remember, 2 incubation cycles will be up to the 7th of June, so we're still not fully in the clear, and so we can't go back to the way we were. We have to be vigilant because this virus is an unseen killer, and it doesn't take much for it to get into the population and to cause severe harm. So again, I want to thank you all for today, for coming out, as the media, for the ministers, the Parliamentary Secretary, you, the moderator, Honorable Merrick Richardson. I thank you, and I thank everyone, and I, say happy Anguilla Day to everyone that I missed, and we continue to move on and to get Anguilla back to where it was, so that we can make our ancestors and those who got us this far proud. So may God bless you, and may God continue to bless Anguilla.
Thank you, Premier. Just a quick housekeeping note before we sign off. Just stay, for our online viewers, just stay posted. We have a pre-recorded message by the Honorable Deanne Kentish-Rogers, Minister for Social Development and Education, that will be played right after this. Once again, thanks to everyone for tuning in.
Good day to all educators on island. Thank you for taking up the task for educating our children in an online learning environment during the lockdown period. Further thanks are in order for you returning to school to continue education in person. I understand that there are many of you who will continue to have mixed feelings as it relates to reopening schools at this point of time. A large minority of you may have voted to stay at home and continue remote learning until the end of the term. These concerns are entirely valid, as you may have been wary of safeguarding your health in an environment where close contact with a large amount of people is likely. This period represents a significant change and loss for adults and children alike. 10 of our students tested positive for COVID-19, as well as several other parents and relatives. Globally and locally, we faced weakened economies, food insecurity, widespread unemployment, increased abuse and addiction, and an overwhelmed social services system. We must not underestimate how these factors have shaken all of us living through this period of disruption, especially children. Some of us are struggling to regulate our emotions, something that may be much more difficult for children. Remote operations have afforded many of our children and teachers the ability to interact in an environment that is safer for public health. The return to school serves many purposes beyond classroom teaching. While many students had the ability to thrive in the online learning environment, we are equally aware of students who struggle with independent study, who did not have access to digital tools, and come from home environments that are not conducive to learning. With this knowledge, our obligation is to mitigate against the harmful effects as much as we possibly can. There are those among us who are affected in unknown ways. How that manifests will be different for all of us, but a basic assumption that we can make is that not all of us will be at our best selves right now. It is important to use empathy and understanding. When we meet each other and children during this stage, our focus must primarily be on addressing well-being and learning gaps. However, the health team has advised that as we have returned to stage 0, with no confirmed active cases on island, we may remain adequately safe through mask wearing and frequent hand washing. In this environment, every one of us is trying to do our best. It is much easier to go at this together than at it alone.